Guys, welcome back to my channel and happy Sunday to each and every one of you. I know there's a lot of talk in the media about the coronavirus, but I have not seen very many videos that talk about what to do if you actually think you have the coronavirus. So I did a little bit of research and I'm just going to share what I found here. So do I have the coronavirus? First off, I hope you don't, but if you do, this would be a good plan of action for you. And I'm going to go through this really quickly. So the first thing I would do is ask myself some questions. Am I in an increased risk group? Did I recently travel to a potentially affected area? Am I something like a nurse or a police officer where I've been exposed to maybe infected people? Have I been caring for someone that I know has the coronavirus? And do I have existing comorbidities? Like, do you have diabetes or something like that? Not that that means that you have the coronavirus. It just means that you need to be more careful because comorbidities increase the risk of complications. The next thing I would look at is what's the timeline? So there is, some speculation about whether it's 2 to 28 days of incubation time. But if you're inside that window and you're experiencing symptoms, then it's very realistic for you to monitor yourself and ascertain whether or not you may be at risk. This is when I would start to keep a log. When did your symptoms begin? And just write stuff down because you think you'll remember, but you won't as time goes forward. If you think you have it, what do we do? So the first thing is don't panic. And I know we hear that all over the media, but the reason I'm saying don't panic is because it's impossible to think logically if you're panicking. So don't panic. Whatever it is, there's a plan in this video. I'm going to show you what to do, okay? Let's be practical and just keep yourself and other people as safe as possible. So the first thing to do is to look at the symptoms of the coronavirus and then match them up against your symptoms. Do you have any of the following? Fever, cough, sore throat, rapid heartbeat, dehydration, high or low temperature, high or low blood pressure, confusion, fatigue, shortness of breath. And you can have all of those symptoms and not have coronavirus. You can have just the flu, or you could just catch a bug, or just be feeling a little off because you're not resting properly. But these are symptoms. The two that seem to present the most are a dry cough and a high fever. So if I saw those two things in concert with one another, I would be more concerned than not. And if you want to see how to monitor your vitals, I did a video about that last week and I'll link it in the information cards right here. All right, so if you think you have these symptoms, that doesn't mean run to the hospital right away. That means, okay, let's monitor our symptoms. Let's definitely stay away from work and public places. Don't go on public transport. Like if you have a rail system, a metro system, public buses, airplanes, if you can avoid it, stay away from public transportation and people that are considered at-risk populations. So that's people who are already ill or maybe people who are of an advanced age. Certainly this would not be the time to go visit grandma in the retirement home if you're feeling unwell, okay? Now, what is the actual plan of action? What should you do? All right, so the first thing that we're gonna do is, and I found this website I had not heard about on the press, which I think is kind of silly because it's actually a wonderful resource, and it's called Nacho. Yes, like nacho chips, but not as delicious, but much more informative. So the Nacho website, and that stands for the National Association of County and City Officials, and it's actually a really cool website. So here's the Nacho website, and you basically just click your state, and then it will show you a list of all of your county or parish health officials, which I think is really useful, and I absolutely wanted to make sure to share that with you guys. So I would go there first because I want to know who my high-level officials are dealing with public health in my area. Then I'm going to call my doctor and let them know, hey, here's the situation. This is why I think I may be potentially at risk. And I'm going to listen to what they say, whether that's to maybe monitor further at home or to come in. But what you don't want to do is just show up to your doctor's office and then potentially get other people sick. So please don't do that. And if you are going to go to the doctor, wear a mask. If you have one, if you can find them, definitely wear one because you want to protect yourself and other people. All right. Now, the third thing that you can do is once you go to see your primary care physician, or maybe you haven't gone to see them and you just feel like I'm getting the runaround or I just want more information. The CDC is a public organization, so feel free to ring their phone number, which is 1-800-232-4636, and their operating hours as listed on their website are 8 to 8 Monday through Friday. So feel free to call the CDC. I would. If I had questions, I absolutely would want to get it from the horse's mouth. And then so next step after you've monitored things, and let's say that you got better, well there you go. Just wait out your contagious time as directed by your doctor, and then go back to life as normal. But if you go the other way and unfortunately your symptoms progress, ideally you would seek medical care before needing an ambulance, but sometimes these symptoms, from what I understand, are pretty have a rapid onset. So if you do have to call for an ambulance, give them a heads up as to why you're calling so that they know to wear whatever protective gear they have available to them. And if you've monitored your symptoms and they're getting progressively worse, it may be time to just drive yourself or have somebody else drive you to the ER if you don't want to call an ambulance. But again, please call them before presenting or just walking into the ER, because you don't want to expose, let's say that there's someone there with leukemia who has a compromised immune system already. They certainly do not need the coronavirus. So please give your local ER a call and ask them what their protocol is for accepting patients who potentially have the coronavirus. So then now what? Okay, so we're at the hospital. The hospital is going to run some tests. They're going to run something called a PCR test, rapid PCR test, if they have it locally and if they agree that you meet the CDC criteria or whatever the local criteria is for testing. Now, if you're in the United States, then it's probably easier to win the lottery right now than to get tested for the coronavirus, but hopefully in in the coming weeks, that will change. And then based on those test results, you're going to be asked to do one of two things. If it's positive, they very likely are going to ask you to stay in some kind of an isolation room or put you in a mass quarantine tent. Of course, that is going forward if we have a higher influx of cases. We simply don't have the isolation rooms here in the United States for everybody to have one. It's just the math is against us on that one. So you would be asked to go to sort of like a mass quarantine, maybe a tent or an area or a hotel, however they want to handle that for treatment, or you would be asked to go home and self-isolate. So let's say that you had mild symptoms, but they tested you for whatever reason and they said, yes, you're positive. I'm not really sure what they would do in that instance, but I have certainly heard many, many anecdotal stories about people going to the hospital who were very, very much in a high-risk category, in my opinion, who were not tested and were sent home from the hospital and just asked to self-isolate. So that may be another outcome for you. The biggest takeaway from this is, guys, it's time to take care of yourself and other people. Do not continue to go to work or just carry on as usual, going to the mall, going to ball games and movie theaters and such. If you're feeling unwell, there's no nice way to say it. That's irresponsible, right? You're a citizen. You don't want to infect other citizens. We're in the middle of a global, call it a pandemic if you want. Don't call it a pandemic if you want. Look at the world map, guys. The numbers don't lie. And to that end, of course, this is not the world. This is just the US. But guys, look at the map. And eventually those pieces will all be filled in. So we all have to do our part. So if you're feeling unwell, don't spread it to other people. There are just too many people, not enough doctors, not enough hospitals. Again, the math is just not in our favor on this one. And everyone just has to do their part to keep everyone safe and reduce the spread of this virus. So the reason this picture is here is, don't just go to work and be coughing on Bob and Bill and then they take it home to their wife and their kids, and then their kids take it back to their schools. And then before, you know what I'm saying? That's how you get this, what's this saying that's coming up around this, case, cluster, cluster, boom. And that's how it happens. And this thing it's very contagious. It has a very high R naught, which is the level of how contagious it is. It's just easy to spread. So take more care than not. And I thought I would close with this, the Hippocratic Oath that doctors take, which a part of that is first, do no harm, right? It's everyone's job. Please do your part. We're not all medical care professionals, and we can't all be out there on the front lines, and we're not all part of the National Guard being deployed to help, contain civil unrest. But what you can do for yourself and your community is exercise a higher level of caution if you feel that you may be at risk. And certainly, if you know that there's a problem, just be careful. Protect other people. Do what you would want other people to do to protect your family members, right? The golden rule, do unto others. All right, well, that's going to wrap it up for today, guys. I hope you enjoyed that, and I will see you in the next one. Thanks for spending some time with me. If you enjoyed this, don't forget to leave a like, a comment, or any questions that you have below. And if you want to be notified when I upload my next video, go ahead and click subscribe and turn on that little bell notification. I'll see you guys in the next one. Bye-bye.